Hello again, I'm Dr. Hung and our show is America's Healthcare Crisis. This is our 49th show, and its title is Leadership in Medicine Part 3, The Physician's Role. As I had mentioned before, this is part of a series of productions on leadership in medicine. I had mentioned that we are currently in our country in a state of great crisis in terms of our healthcare delivery system. We're spending annually about 14% of the gross domestic product on healthcare. And it is estimated that if we continue to do things the way we have been practicing until now, in another 30 years, we will be spending 30% of the GDP. So needless to say, it's very alarming. And during the time of crisis like this, it is extremely important to address the issue of leadership. And I have the great pleasure and honor to have with us tonight a articulate and very knowledgeable speaker who is currently the physician-in-chief at the Kaiser Permanente medical group in Santa Clara. He has the awesome task of leading and coordinating more than 300 physicians, taking care of a large population of patients in Santa Clara of about 250,000. So let me introduce him. Dr. Pearl, Dr. Robert Pearl, how are you tonight?
Good evening. Very well, thank you.
Welcome to our show.
Thank you. It's a pleasure.
Thank you for being here to share your thoughts with us. Now, you have taken over the helms at Santa Clara Kaiser Santa Clara for how long now? A year or so?
About a year.
Okay, how is it going?
It's going very, very well. The healthcare crisis, as you mentioned, is one that we're constantly addressing, and I believe that the physicians understand what's happening, and I believe that the healthcare that we're giving is improving constantly.
Great. So you mentioned earlier to me during our private talk that you have been focused on the issue of quality medical services. How is that being defined at Kaiser?
I believe that quality is the future of medicine, that every time you try to look at any of the parts of medicine, be it cost or service, that it really comes back to, in the end, to quality. Mm-hmm. Quality is really defined as the outcome. Mm-hmm. How did the person do? Did you prevent disease? Mm-hmm. If they got disease, did you treat the disease? Mm-hmm. And what was your outcome? Mm-hmm. And the programs to get best practices and the data to evaluate those programs are really coming forward very rapidly.
Mm-hmm. The problem of medicine is that the outcome and the cost are two opposing forces, isn't it? Because sometimes the problems of physicians when they practice is that if they order a lot of tests and fish things and they try to diagnose early, it may cost too much. And then if they wait too long, the outcome may be bad. So that is how the quality has been sort of a tricky.
Well, let me start by saying that first, I really believe that the cost and quality are not opposites. They're the same.
Okay.
I think that when you prevent a disease, it's very cost efficient.
Okay.
When you can cure a disease and not have to treat the complications of the disease, it's very cost efficient.
Okay.
So I don't see them as a problem. I think you're absolutely right that we have not had enough emphasis on outcomes, but I think that's changing. We currently, at least at Kaiser Permanente, we monitor probably hundreds of outcomes, but some very, very significant ones. I mean, as an example, we monitor the outcome of patients with heart attacks. How do they do? We monitor children with asthma. Do they require hospitalization?
Sure.
We monitor the outcomes of certain operations. Do they have a stroke after carotid surgery? You're absolutely right that medicine is so broad, it's so hard to figure out every endpoint. But I think we're now finally doing this measurement, and one of the things that I am very proud of at Kaiser Permanente is that we're able to manage the outcomes for large populations of people. We're able to say that if you're pregnant and you deliver at Kaiser Santa Clara, your chance of having a healthy baby is far greater than if you pick a hospital at random. If you have a heart attack, your outcome is going to be far greater than if you're hospitalized at a hospital at random. And we're able to measure that and follow that. I think the trend of the future is going to be getting the data to be able to manage common diseases, ones that are less life and death oriented. What's the outcome of diabetes? Can you prevent heart disease?
Sure.
Can you keep someone healthy and let them be functional in their family, functional at the job? And that's the data systems that we're putting together right now.
Yeah. So have you had the opportunity, or are you planning to publish those data?
Well, some of the data actually is constantly being published. The HEDIS data that you're well familiar with, the national data, actually is published in the newspapers. We have agreements with many of our purchasers, the large companies, that we will not only do these studies with them and present the data to them, but if we fail to hit the targets, we'll actually refund the money.
That's great. That's almost like money guarantee, money back guarantee.
Money back guarantee. In fact, we just actually put in a service guarantee, but we have with the purchasers a quality guarantee.
That's wonderful. That's exactly the standard that any other business has gone through, and then it has not been applicable to medicine. Now, you're talking about the focus on prevention. How do you effectuate that at Kaiser? Because of the very basic obstacle in the training of physicians. By nature, physicians are trained to diagnose and to treat, and not to prevent. Prevention is alien to them. So how do you practice prevention at Kaiser?
Well, again, I talked a little bit about the potential upside of the current crisis in healthcare, and I think one of the upsides is prevention. Some of the same guarantees to the subscribers are that we will screen women with mammograms on a prescribed basis, pap and pelvic examination, immunization, hypertensive screening, because in a sense, the business of Kaiser Permanente as a prepaid program is prevention.
Right.
The most cost-effective, highest quality is to prevent the disease. And what we have now are computer systems. So when you walk into the physician's office now, the first thing that will flash up on the computer screen are going to be your preventive screenings. And if you haven't had your blood pressure checked, even though you're seeing the ophthalmologist, he or she will make certain that your blood pressure is taken. And if it's abnormal, then you'll get referred, obviously, to a specialist for that problem. If your child's in to see the surgeon and has not been immunized, it will come up on the same screen.
That's great. That's wonderful. Now, prevention will necessarily involve changing behaviors, changing lifestyles, because in our country, unfortunately, up to 75% of Americans are overweight. How are you going to do that at Kaiser?
Right. I think that's a very, very good point, that we in this country have wanted to get treated for disease and have never been willing to focus on what it takes to prevent it. We certainly have classes, and we encourage people to get into the classes to get the treatment. We have a very active health education program. We actually are now putting in some alternative type stress relaxation programs that we aim both for patients and for physicians and for medical staff. I think that still the patient has to take responsibility, and I think that's a bigger, as you've pointed out, societal issue than just a medical issue.
Yeah, because interestingly enough, I have learned through these productions that really it has confirmed my belief all along is that the so-called revolution in medicine is just the triggering factor of a whole bunch of other revolutions. It's of cultural, social, political, whatever. So it's very interesting. You look like you are the example of a good health here. I mean, you look marvelous.
Thanks.
You look like I mentioned, an Olympian. The way you
I mean, I do think that it's important that the physicians set an example.
Sure.
And I think that most of the studies that we have on how to manage conditions such as diabetes, such as hypertension, I think that's a lifestyle change.
Right.
And I'm hopeful, again, out of this crisis, that more and more Americans will deal with the lifestyle issues and will get more involved in prevention.
Well, the argument among the providers now is that they are going through a lot of anxiety and stress, because if we turn things around and start talking about prevention and not treating and practicing the way we have been doing, a lot of us will be out of a job.
Well, that's the natural evolution, I really believe, of business in the United States. I think that, again, as you and I were talking a little bit, whether you're talking about computer industry in this valley, the banking industry, telecommunications, all these industries have evolved. And they've evolved to the point where essentially all of us as Americans have an improved lifestyle. And I think the same thing is true. I think there are other areas that talents will go to improving lifestyle,
Yeah.
to improving people's lives,
Yeah.
as we change what we do as our primary business.
Right.
I think if we put less resources into having to treat disease and more to prevent disease, we're going to be able as a nation
Yeah.
to be able to enjoy
I
life.
cannot agree with you more, Dr. Pearl. I really am glad that you mentioned that up here, right here, because interestingly enough, Japan only spends 6% of the GDP for healthcare, and its major emphasis on prevention, and it has enough money to cover the whole Japanese population. Whereas we here have been stressing curing and treating and technology and all that. We spend 14% and 39 million Americans are out of the loop. So I'm very pleased that you mentioned that, because in a leadership position like you are holding right now, it's crucial that you mentioned that, because that is exactly how I see the future of medicine in our country. Now, one of the very sticky questions I have to ask you, you have 300 physicians under you, and I have to say this, that I have been through a lot of institutions in America. And one of the unfortunate aspects of medical training is that it's extremely competitive. And physicians are not trained to work in a team. How do you go about modifying that type of behavior from a physician's viewpoints?
Sure. One of the reasons why I went to Kaiser Permanente when I finished my residency was that I really believed that the task of the physician is to maximize the health of the patients for whom they treat, and that the incentives in Kaiser, which is essentially the subscriber paying the dues, and the physician along with the member figuring out how to maximize that healthcare dollar, is what medicine should be about. I think that the evolution of the American populace has been towards that point of view, and that from that standpoint, the first thing in Kaiser Permanente is some degree of a common vision. I think that we all agree that our job as physicians working together is to maximize that health care. And so we don't start by being competitors in the same way that a community of physicians, each of whom has a separate office. Each time a patient goes to one office, they're not going to someone else's office. So in that sense, I'm very fortunate. I have a job where I have a camaraderie, where I have a group of physicians that have a common mission. And I think that that's the first thing. I think the second aspect is to develop that common vision. And if everyone can agree on what quality outcomes are, then people are much more likely to agree that this is the way to achieve it. I think the third thing is that the personal financial incentive is much less in our organization. And so the willingness to read the literature, to look at the literature, to talk about experiences, and to come up with best practices is something that's much easier to foster in my environment than it is for some of my colleagues in the community.
I have to go back to that aspect again, because as I mentioned earlier, unfortunately I have noticed that the training of physicians has not fostered the qualities such as humility, adaptability, and flexibility. There are a lot of physicians who are very strong in defending their way of doing things. We know that for a fact that if you get a physician from Stanford or Harvard or Yale, they may practice a little bit differently, or very differently sometimes, but each one thinks that he has the best pathway or way of practicing. I still don't see how you can get people to sit down and say that, well, your way is better than mine, let's adopt yours. Is that something that has happened at Kaiser?
Well, I mean, certainly people are different, and differences of opinion are very, very valid. I think progressively, especially as we go to develop best pathways, there's a commonness of reading the literature together. One of the things physicians don't do in most places is read it together. If you and I sat down with an article and discussed it and asked ourselves the question, what do we agree on and what do we disagree on about this article? We'll agree on most things about it. We're both reasonably trained, common background individuals, and we'll have some of the same thoughts. That's a process that's much easier to foster in Kaiser Permanente at Santa Clara, and then Kaiser Permanente across the whole region. And it's that sitting down together in a common department to look at that, where we may also disagree at the edges, but we're going to agree on the core. We're going to agree 90% of the way. And as long as we get that common agreement to the best pathway based upon the literature, then it's not your opinion or my opinion, it's our common opinion.
I think you're able to achieve that at Kaiser. That's great. I really applaud that, because I have not seen that throughout my career that have been achieved anywhere. So again, maybe you can give us a definition of the mission as you see it in the vision, as you see it, what is going to happen 3 years from now, 5 years from now at Kaiser?
I think that the mission of Kaiser is to be able to maximize the quality of care and the quality of service to our membership with the healthcare dollar that the public is willing to spend. That's our mission. Our job is to help maximize that particular care. I think in doing that, in my mind, it's prevention. The more we can prevent, the more we can achieve our mission. It's to high quality. It's to get it right the first time. And then it's also, when a problem arises, to treat the problem most effectively. So I think the mission and our business are identical. And in that sense, again, I think it's a lot easier for me to do the kinds of things that you've talked about yourself, about quality outcomes and quality approaches, than it would be if I had a different position.
You know, for a very long time, medicine has put a great emphasis and focus on technology and technical skills. I mean, obviously, we compensate technical skills much, much more than cognitive or even the ability to coach or to teach or to educate patients. Is that happening at Kaiser, that you reward more the physicians who are a good teacher and somebody who can inspire patients to change their behavior? I mean, the problem is that I see that throughout the years, the fantastic development in technology has created a lot of unrealistic expectations in patients. They can go through 30 years of bad habits, and then when they get a heart attack, they want to be fixed within 2 hours. You know, I mean, like the doctor who does bypass is a hero, and they feel that they renew a few hours later. Is that going to be the reverse of that trend in the future, you think?
Well, I think there's a place for technology. I think that one of the reasons why we're seeing a lot of change in hospital utilization is the advent of new technology. And it's for the good. If you need your gallbladder taken out, you'd much rather have it done with an endoscope and be out of the hospital the next day and back playing tennis in 3 days than the old system of doing it. I think at the same time, the point you make is very good. We have not rewarded in the traditional medical system the physicians prevented disease. And the salary structure within Kaiser recognizes technological ability, but also recognizes the opposite, or the alternative. And within that, we measure again for the single physician. How well did you screen your patient for high blood pressure? How well did you manage the visual complications of diabetes? How many of your patients are immunized? Did you get the appropriate mammograms? This is measured on a constant basis. So the feedback loop is to say to the physician, this is very important, and part of your compensation is based upon not how you treat disease only, but do you prevent disease.
I see. That's marvelous. And how did you, who have been your mentors, or who did you learn leadership from? Yourself. That's a personal question.
Well, I think that part of learning leadership, you don't only learn from the hands-on person, you learn from role models. And again, within my job, the founder of Kaiser Permanente, a gentleman, Sidney Garfield, back in the World War II era, actually made his living by preventing disease. He went around the shipyards and the Grand Coulee Dam hammering down nails that were sticking out. I think that Bruce Sams, who was our executive director when I first came, constantly made the point that we have a mission, and our mission is to help prevent disease. Our mission is to be able to give care, quality care, high service to as many people as possible. And I think it's that the value system that I would say is the role models for me.
Yeah, that's marvelous. But you know, when you are in medical school, they're not talking about prevention. I mean, the whole training is how to diagnose and to treat. And I think it's pretty remarkable that you stay away from that mode and get to this position. And yet, it is my feeling that it's inevitable. The evolution in medicine, like you mentioned earlier, has to come. And through this crisis, again, I agree with you. It will emerge a new leadership with a different way of doing things, with different vision, and maybe it's for the better of our healthcare delivery system. And now, let me see what else. What is the criteria? Are you recruiting any new members, physicians for the for Santa Clara Kaiser?
Yes, this year we'll be hiring 17 new physicians.
I see. And what are your criteria for selection?
Well, let me start by saying right now we're in a period of very rapid growth.
Okay.
And so a lot of our hiring is to address that. And what we're recruiting a lot of are physicians with primary care skills. Because again, what we've recognized is the need to prevent, the need to, we want to be, what we would like to do is to have every member identify with a personal physician who can help develop that individual, get a life care plan, who can help prevent disease and manage them along in the progression. At the same time, recruiting for some very highly trained specialists. So both of those are there. I think in recruiting right now, I'll say fortunately, it's very easy to recruit high quality individuals. And that is what I've said to each of my chiefs. I said, the question that I have for you is this an individual who's in the top 10% of the United States? Because that's the quality of physicians that we need in this area to give care. Now, how do you measure top 10%?
Right.
They obviously have to be well trained. They need all the credentials. And then I think it comes down to them as people. How do they relate to their patients?
The human qualities.
The human qualities. And then, as you probably know, we monitor our physicians for a 3-year time trial. And during that, we constantly are assessing our membership to evaluate the physicians.
Yeah.
How did they relate to you? What kind of service did they give you?
Sure.
What kind of prevention did they do?
That's great.
And they have to be able to achieve these ends as well as having the technical competence.
Now, I have this question that sometime has been raised in terms of addressing the system like Kaiser, is that some people feel that the Kaiser has a built-in kind of situation when if you reach a senior position or something, you cannot be eliminated or something. So once in a while, you have to come to the decision that a physician, for one reason or another, is not meeting the standards. How did it go about? How the peer review process going at Kaiser?
I think that's a very good question. And although this may sound very strange to say to you, one of the things that I'm very proud of is that we have identified problems. Because problems are going to exist. We have a system of peer review through departments where various outcomes are monitored and deviations from an expectation are identified.
Right.
And so that if you as a surgeon have a series of complications that are very different than all of your peers, it may just be chance, it may be significant.
Okay.
So that will mean we need to look at it. And at that point, we'll do a study. And we'll pull the records of 10 of your patients and 10 of your colleagues' patients. Maybe your patients were sicker.
Right.
If after all of that...
The circumstances of care.
Circumstances might have been very different. If after all of that, it still seems that it's different.
Right.
We have a chief of quality and a chief of risk management, and myself and the chief of the department will get together and look at this performance. At the end of that whole process, if it turns out that we still feel there's a problem, then we'll put you on some type of probationary period that will monitor you.
Okay.
We'll go to the operating room with you. We'll review your charts. If at the end of all of that, there's still, we think, a risk to the member, it's our obligation to step in there and intervene.
Okay. Dr. Perry, seems like you're doing all the right things. I congratulate you, I applaud your effort, and I hope that your leadership will stay and Kaiser Permanente will grow, because we need a model for not only California but for the whole nation. And I admire that, and I think that this is, again, another thing I would like to mention is the reason we're here is because I feel this is very important to get the message directly out to the public, because medicine has been a very sheltered and almost closed kind of system. We publish in scientific journals, but we need to communicate directly to the public, and I'm very pleased and I'm very honored to have you here tonight. And I wish you the best of luck, and I think that in the future things will come out certainly very, very nice for your organization. And again, this is Dr. Vu. Our show is America's Healthcare Crisis. I have had the opportunity to interview Dr. Robert Pearl, Physician-in-Chief at Kaiser Permanente Medical Group in Santa Clara. And I hope you have enjoyed our show. Please tune in for further productions in the future. And for the time being, thank you for watching. So long, good night.
Do you love someone? Have you ever cared? Do you miss someone? Have you ever shared? Do you need someone to always be there when you feel lonesome and deep in despair? Do you need someone to dry up your tears? Do you need someone to always be near? Do you have someone to stay through the years? Let me be